Okay, so determine the person is a Cat 3. We're going to do prone leg length analysis first. So while the patient's prone, doctor's standing at the end of the table. I'm going to bring your legs out a little laterally. Now Johnny, I'm going to have you press out laterally into my hands for 3 seconds. Bring the legs back in. Check the malleoli. And Johnny has a short left leg. From there, we're going to go to the glute fiber analysis. So glute fiber analysis, you want to state that the PSIS relates to L5. So these spots along the iliac crest relate to lumbar. PSIS is L5, and then you go around the arc, L4, L3, L2, and L1. So this is similar to trap fiber analysis, where we'll press into each point, apply pressure to each point. So first PSIS, and then L4. And while you're pressing into these points, you're asking the patient which one is the most tender. And you go from there. This patient's not on blocks. Is that pretty much it for that? Okay, and then indicators will come down to the calf. So indicators of the calf would be if the calf actually is painful. Then you do thigh. You can do a glute, and then you also do the TS line. Feel it for pain. Now, so what you'll do here is after you had blocked the patient category 3, we go back and check the indicators to see if there's any reduction in pain, or if there's still pain. For the Soto test, the indicator for Soto is sciatica. This is both a diagnostic and therapeutic test. Patient's prone, not on blocks. Doctor's seated at the side of the table. So grab the leg. We're going to bring it out until as far as the pain or the patient can handle it, and also until there's bunching. We're going to externally rotate the leg, toes out. We're going to hold this position for 10 to 15 seconds. Once that's completed, we're going to wait 2 minutes, and then we would repeat. If the problem was better, this would be a piriformis problem. If it became worse, it's a sequestered disc. And if it stayed the same, then it would be a herniated disc or subluxation. For Cat 3 blocking, the patient's gonna be prone. There would be a sternal roll placed under his chest. The board here would be placed 4 inches above the iliac crest. We won't do that there, but that would have been the board. For blocking, for Cat 3 blocking, we're going 45 degrees inferiorly at the trochanter of the short leg. This is passive blocking. So lift the leg, trochanter here, and on the long leg side, again passive blocking. We're going to place the block 45 degrees inferior to the ASIS. Leave it here. The goal of Cat 3 blocking is reduction of pain, and the maximum treatment time is 30 minutes. Okay, so for Category 3 block augmentation techniques, first we begin with the posterior iliofemoral ligament. So we're going to come down, patient's prone on blocks, doctor's at the foot of the table, grab proximal to the ankles, and we're going to internally rotate, looking for restriction. So we found restriction on this side, on his right, so we're going to come up on the side of the patient, and we're going to find the trochanter. We're going to go 1 inch superior, 1 inch posterior, and apply a double thumb toggle. If there is a block there, you are able to remove it. Then you place back, so the double thumb toggle. After the toggle, we're going to come back to the foot of the table and recheck, proximal to the ankle. All right, now we're set to move on to lumbar derotation. For lumbar derotation, we're going to start on the patient's involved side. We're going to grab the proximal to the ankle and flex the knee to the glute as I apply a lateral to medial pressure on the L4 lumbar. It's rotated to the right. In this, lumbar rotation is related to a cervical. So we're going to come up on L4, place the lateral medial pressure, and flex the leg to the glute. All Alright, so that's lumbar derotation. Lumbar inferiority, we're going to have to do the same thing. Actually, I'm going to have Johnny traction at the head of the table. Put his hands up as he was. Lumbar inferiority, you're going to do the same thing. Stand on the involved side. You're going to contact the mammillary or TVP with an I to S pressure as you bring the leg towards the glute. In this same instance, the lumbar inferiority is related to a cervical indicator. So come up on L4, TVP, mammillary. We're going to apply an I to S pressure as we bring the leg towards the glute. Okay. Next is acetabular goading. So for acetabular goading, we're going to be on the side of the patient. He doesn't have to traction the head of the table anymore, so you can put your arms, relax. So we're going to flex the knee, and at the acetabulum, we're going to feel for nodules. Once you find a nodule, you're going to apply a pressure on that nodule.